Hi friends, my name's Jessica and I'm a second-year doctoral student studying nursing. And in today's video, I want to talk to you about patient de-escalation because I think that this is one of the most important skills in nursing and they don't teach you this in nursing school. So I came across this concept the other day about how all nursing is actually psychiatric nursing. And I know that a lot of people are probably like, psych nursing is not for me. Like I hear people say that all the time. And I always think, but every part of nursing is psych nursing. And the reason I say that every part of nursing is psych nursing, it's because in any aspect of nursing, the patient who is not feeling well may be scared, may be anxious, right? So you're dealing with the anxiety, or maybe they're feeling like sad that they're sick or they don't want to be in the hospital. You're dealing with that kind of depression, or maybe they're really just not well at managing their emotions, or you're dealing with that agitation, or maybe they're having mental status changes. So, they're hallucinating or they're confused. And again, that comes back to the mind, the psychiatric nursing. We know as nurses that there is a mind-body connection, right? We always talk about the nursing model of care as a holistic model, and it looks at the patient as a whole. So the reason I say that every nurse is a psychiatric nurse, it's because we are caring for people in very difficult times that bring out emotions and bring out feelings, and we as the nurses are their support system. So the reason I bring this up, that all nurses are psychiatric nurses, ties into the fact of why de-escalation techniques are important. Now, I work in a psychiatric unit, so I get training on de-escalating patients. However, medical nurses and medical units do not always get this type of training. And I don't understand why. Maybe it's an expense issue, but every nurse should be trained in de-escalation because you're dealing with, number one, you are dealing with psychiatric patients, right? Because a lot of these psychiatric patients have medical comorbidities. And if a psychiatric patient comes to the emergency room and they're super psychotic and out of control, however, they also have their potassium's like way off, or they have some other medical condition going on, they are first going to the medical floor before they come to the psychiatric unit. They have to be medically stable before they are admitted to a psychiatric unit, meaning the nurses on the medical units are caring for these psychiatric patients. So you're dealing with psych patients on the medical floor. However, as we discussed earlier, you're also dealing with patients that are in very fragile states emotionally because they are dealing with this traumatic, stressful sickness. So let's go over how to de-escalate patients. The first is to be empathetic and non-judgmental. You don't want to judge or dismiss the patient's feelings because that is how they are feeling. Regardless if it's right or wrong, that is the way that they feel. They could be hallucinating and they could feel terrified, and that is a real experience for them. So you don't want to dismiss their feeling. Number two is to respect the person's personal space. If someone is getting agitated or worked up, you want to keep a couple feet between you and that person. You want to be able, if they lunge at you, if they, come at you at any way, if you are further back, you can get yourself out of the situation. Additionally, being very, very close to the person can amp up their anxiety or their agitation because they just are feeling like you're too close, you're in their space. So give them their space, listen to what they're saying, present empathetically. Number three is to be aware of your body language. So if you're upset and you're talking to me and I'm looking at you like this, what is that conveying to you, right? That's probably going to make you more upset. It's going to make you feel like I don't hear what you're saying, I don't care, or that I'm just don't want to be here at all talking to you. If you're talking to me and you're upset and I'm listening to you like this, it's much more open, understanding, and it's really conveying that empathy. So be aware of your body language and the non-verbal communication that you are portraying. Number four is to keep your emotional brain in check, right? They say two different sides of our brains, right? We have the emotional brain and we have the intellectual brain. So when this patient is upset, and I'm sure many of you have maybe experienced this, but when a person is upset and they are really in that place of not having any emotional regulation or self-control whatsoever, they're gonna yell at you and say things that they may be trying to throw daggers at you. You know, they're trying to find something that hurts you. So they may target your weight. They may target your height. They may target the way you look. They may insult your children that they don't even know, but they just are assuming that you have children and that it will really make you upset if they say something horrible about them, right? You need to keep that emotional part of your brain, right? That emotional part might be screaming at you like, you know, to do something or say something that is not going to help the situation at the end of the day. And you really want to just kind of turn that off. You know, you've got to look at the situation and say like, wow, this person must really be hurting for them to be like coming at me like this, or they may feel like they're not being heard. You got to put on that intellectual side of your brain. You got to really kind of look at the bigger picture, because if you feed into what they're giving you, it's just going to escalate the situation. And I'm not going to say all the time, but a good portion of the time, this can lead to assaults and things like that. So you really want to stay away from that. You want to try to keep that intellectual mind, try to tune into how can I help them? How can I calm them down? You know, what's my body language? What can I say? And we'll get into kind of all of those things. So number 5, this is super, super important, is to focus on the feeling. So by focusing on the feelings, you help the patient to feel heard. So for example, what I mean is the first line of whatever you're going to say back to them when it's time for you to like speak and say something back should be acknowledging how you see that they feel, because that is going to make them feel heard and understood. And I have used this firsthand. This can take a patient from screaming at you at the top of their lungs to like a semi-escalated but way more calm voice. Just using the simple statement of, I can really see you're upset. It's like magic. It's like sprinkling magic glitter everywhere. It really, really helps. And then kind of say whatever you want to say back. Say, for example, you have a patient that's yelling because they are detoxing, they want more meds, you know, they're getting really frustrated. Just saying to them, like, I can really see that you're upset and uncomfortable, and I'm here to help you. What can we work towards together? Like, what is really bothering you right now? Or something like, it's my job to make you feel comfortable. I can't give you that medication at this time. Like if they're it depends, because if you're in a situation where they're upset because they want something that they can't have, like say they get this medication every 6 hours and it's only been 4 hours and they're not feeling well, because you know agitation is a sign of detox. They're not feeling well, they're getting frustrated, they're screaming, they're yelling, they're punching things, whatever. Going in and saying like, I can see that you're upset and uncomfortable. I can't give you that medication at this time, but I can give you these, and I'm going to go talk to the doctor and let them know that you're really not feeling well. Now you're on their side. You guys are a team. You've created that therapeutic alliance. And they may not be like super happy, cheerful, but I mean, I've seen this flip people like real quick. Like these are kind of psychological techniques a little bit, because, you know, it's difficult, and especially for people who come into the hospital often, depending on the type of care they received at their previous admission is going to affect the way they're perceiving this admission. So say they didn't get the best care, say someone was mean to them, or they just didn't feel understood, or that they had that therapeutic alliance or whatever, they're going to project that onto you. Their previous experience in the hospital is going to get projected onto you, and you need to remember that. So I always like to go in and try to create the like team approach, which depends, right? I mean, this works well when we're talking about that situation with addiction. Now, if we talk about a different situation, like somebody actively hallucinating, that's going to take a little bit different approach. So you can say things like, I see you're upset and that you're really scared right now. I don't see those things and I don't hear those things, but I can see that you are upset. I'm here to help you. Like that's kind of the approach you can take with that situation. So you also have to kind of look at the situation that you're going into. Number 6 is to ignore challenging questions. And what this means is when a patient challenges your authority, do not feed into it. So for example, a patient might say to you like, "You're not the doctor. You don't know what you're talking about." That kind of challenging your authority. Feeding into it rarely ends well. Just don't do it. Instead, focus at the problem at hand. So if a patient says to you, "You don't know what you're talking about," you don't need to be like, "I went to nursing school and I did this and I did." Now we're just arguing about nothing. Like we're just arguing about things that it doesn't solve anything. It's just wasting time. Focus on the problem at hand, not at changing their perception of you. So number 7 is to set limits. When I say set limits, these are the hard limits. These are the things that there's no flexibility to. Hard limits aren't you calling the shots. Like you're not getting your medication now. Like that's not the correct setting of limits. Setting limits is meaning if, say, a patient is trying to leave a locked unit, you can't. There's no flexibility there. The patient cannot leave the unit. And also giving patients choices works well. So maybe you're setting the limit that the patient can't leave the unit. Like, "I'm sorry, you can't leave the unit. This is a locked unit, but would you like to go to your room or go to the milieu?" Like give them choices. By giving them choices, you're giving them a sense of control, and that can be helpful as well. Which ties into step 8. Which is choose what limits you set wisely. For example, say that a patient doesn't want to shower in the morning. However, they want to shower in the afternoon. That might be a rule that's okay to negotiate. Number 9, and this is one of my favorites, is to allow silence for reflection. What this means is by offering silence, it can give a patient a little bit of time to reflect back on what is going on. And this also helps the patient to kind of reflect on what decision they want to make. So right when the patient stops talking, you don't need to start talking. If it's a moment where you're waiting for them to kind of choose or, give you feedback on something, offering that silence is kind of like giving them a second to think, which is really great. And this sort of ties into number 10, which is, I think, also one of the most important, is to use open-ended questions. You don't want to ask patients yes or no questions when they're upset. And that's because it can kind of feel like you're interrogating them and that they're not feeling understood. Say, for example, a patient is upset and you're like, "Are you upset because you're tired? Do you want food? Do you want to shower? Do you want to go do arts and crafts?" And they're just like, no. And then they're getting like more agitated. It would be better to be like, "What helps you when you're upset?" And by asking that, it helps the patient to like reflect back, also allows the patient to feel understood. And it also helps the nurse because it helps with our assessments. So when we say to the patient, you seem upset. Is something bothering you?" They're like, "Yeah, actually, like I'm not feeling good and I have this and my stomach hurts and my head hurts and no one cares and blah, blah." And they're just going on and on. 1, they're getting out all that frustration. 2, you're now like, okay, I can offer them Zofran. They said they haven't eaten, so I'll see maybe if they want some toast because they have an upset stomach. And you can kind of like tack these things so that when now they're done venting, you can say, "Wow, I see that you are upset. It must be really uncomfortable to have an upset stomach. I can give you some Zofran. Do you want some toast? Maybe some ginger ale?" And a lot of times the patient's whole mood will change. "Oh, really? I would love ginger," whatever. Sometimes it doesn't and they get more agitated, and that's when you can kind of use the other techniques that we talked about, acknowledging and offering to discuss with the doctor about different medications, or, you can really assess what is wrong and then offer feedback to help them feel understood. Sometimes that there's nothing you can do. This patient is upset. They're upset for a legitimate reason. It is totally out of your control. You cannot give them what they want. For example, their children just got taken away by DCF. There is nothing I can say to make that situation any better. But going in there with the patient being like, That sounds really horrible. I'm so sorry that you're dealing with that. What can I do to help you right now? Is there anything I can do to help you? Could make all the difference. You know, they're still gonna cry. They're still gonna yell. They're still gonna be upset. Understandably so. They're really screaming and flipping out. You could say to them, I really need you to like take your voice down just because of the other patients. Like, I'm so sorry that you're dealing with this. Sometimes there's just nothing you can do. This is how to de-escalate. I hope that you guys found this helpful. I think that this is a really, really important skill for nurses in any field, any setting. I think it can make all the difference in you creating a therapeutic alliance with the patient, which really is your foundation for nursing care, and really can just make your life easier too, because you create that relationship with the patient and, you know, it grows from there, and you can really help to have that patient have better outcomes in the future and give them teaching and things like that. So hope that you found this helpful, and I will see you guys next time. Make sure to give this video a thumbs up and subscribe to my channel. Bye.